Most people think about palliative care, they think of care at the very end of life. And this research aims to look at that stigma and look at that attitude that most people have towards palliative care and break it apart and analyze it and figure out how we can manage to have more people access palliative care who could need it, but who otherwise feel that it would stigmatize them or place them in a place where they don't want to be. There were several key findings for this study. Firstly, in both groups, in the standard care group and the early palliative care intervention group, both patients and caregivers in both of those groups said that they had initially perceived palliative care as synonymous with death, basically. But importantly, in the intervention group, this perception somewhat changed. During the course of the intervention, they began to see palliative care as being relevant early in the course of illness and as being beneficial to them, supporting them, and improving their quality of life. In the intervention group, although they found that the early palliative care was beneficial to them, they also felt stigmatized by the label of palliative care. They said that the source of this stigma was mainly within the medical system. So it was doctors and nurses who had given them and also their family members and others the impression that palliative care was only end-of-life care. And another prominent source was actually the media. So I think those are two powerful institutions where we could affect change and give a different perception. My name is Dr. Camilla Zimmerman, and I'm a clinician scientist and head of the palliative care program at the Princess Margaret Cancer Centre.